The free T3 is the thyroid hormone that warms up your hands, warms up your feet. I see patients come in and they say, I have to wear socks every night because I get so cold, I can't sleep.
Hey, Kyle Colbert here, and I'm here with my dad, Dr. Don Colbert, and my mom, Mary, and this is Dr. Colbert Broadcast, and we just got done talking about testosterone levels, but today we are talking about thyroid.
Yeah.
And I know this is a key organ for metabolism.
Yes. Well, we're seeing an epidemic of obesity in this country. And a lot of people in this country have sluggish or underactive thyroid, which we call hypothyroidism. In fact, 5% of Americans have hypothyroidism, but what's interesting is about 5 to 8 times more common in women than in men, because we have the X chromosome. Men and women have the XX, men have the XY. On the X chromosome, there are genes on the X chromosome associated with autoimmunity. So women are 5 to 8 times more prone to develop Hashimoto's thyroiditis or autoimmune thyroiditis than men are. And so again, we see more thyroid problems with women, and also estrogen stimulates the immune system. So when you combine those two, that X chromosome, 2 X chromosomes, and the higher estrogen levels, it puts them at a much higher risk of autoimmune thyroid disease. And so again, other causes of low thyroid include it's usually from the thyroid being low, but also the pituitary. You could have a pituitary disorder, which is most commonly caused by a pituitary tumor called a prolactinoma. It's real rare, but it can cause low thyroid. So again, it's just a rare.
And just to back up really quick, so, and I'm trying to follow you on the thyroid.
Yeah.
Is the thyroid just controls the metabolism? Is that why it's important?
Yes, that's a major thing it does. It keeps us warm. It keeps our metabolic fire. Think of the thyroid like a bonfire. The hotter it's burning, the warmer you stay at night.
Kind of like
As
your
we get older,
thermostat.
like a thermostat on a house. Okay, so when you turn that thermostat down, you start to get cold. You don't move as much. You start to get sluggish. Your brain doesn't think as fast. You start to gain belly fat. So when your thyroid is low, you get tired. You get run down. Your hands and feet get cold. You get more belly fat or more fat on your body.
Is that one of the first signs that you'll see with your patient?
Well,
They
the
say, my
biggest sign-
hands are cold.
Yeah,
feet are
I
cold.
touch their hand. I shake hands with everyone. When I shake their hands, I can feel. Now, I have their temperature. We check the vitals and temperature on everyone. But when I check their hands are icy cold. And I mean, it's like 10 degrees lower than their temperature.
Okay, we need to have your thyroid check. Your hands are freezing.
Well, it's
Real cold in here. So when their hands are cold, that's a sign they have sluggish or low thyroid. And so what I do is I check their numbers. Now, again, the main causes of low thyroid is autoimmune thyroiditis, like Hashimoto's, or thyroiditis from infections, or thyroiditis from after pregnancy. These are major causes of low thyroid, but also it can be other things such as thyroid surgery, radiation to the thyroid, to the head or neck, can cause it low iodine levels, or it can be a pituitary problem. With the pituitary it could be a rare tumor of the pituitary, which is rare, or a tumor of the hypothalamus, but those are extremely rare. Or it could be subclinical hypothyroidism, where the body just doesn't heat up enough. It's not high enough to be regular hypothyroidism, but it's just it's subclinical. It's just mild hypothyroidism. But also it's due to these chemicals, guys. It all goes back to these endocrine-disrupting chemicals we're exposed to, and especially the parabens. Now, parabens are a type of chemical that they put in all shampoos and body washes, conditioners and lotions, and it prevents mold and fungus and bacteria from growing in them. So these parabens, most of these personal care products contain parabens. It needs to say paraben-free or zero parabens, because they will interfere with your thyroid. And they will you can start to develop subclinical low thyroid.
How about heavy metals?
That's not, well, it can, yeah.
From your mercury filling?
Yeah, mercury and fluoride and all can affect the thyroid, and bromide. Those are halogen chemicals, but that's not a common thing there. Now,
And you're saying the most common though is would you say is Hashimoto?
Hashimoto,
I've
but
heard, I hear that.
autoimmune. It's autoimmune thyroid.
And a lot of the autoimmune is generally caused by fluctuations in hormones, massive
Well,
fluctuations.
Well, not fluctuations, but it goes back to that X chromosome. In women, they have the two X chromosomes. Men just have an XY. The X chromosome, when you have genes on that chromosome, will push a woman toward autoimmune issues like Hashimoto's thyroiditis. And also, estrogen increases inflammation. When your estrogen's higher, you have increased inflammation, which can affect the thyroid.
And women
So
generally
that's right.
experience this at certain ages, correct?
Yeah,
Life cycle.
it's usually in their 20s. Again, these hormones are tweaking, or during pregnancy when they can develop these autoimmune conditions.
Not during menopause or anything like that.
Or
That
they can
won't trigger
develop
it.
during menopause too. When you have hormone fluctuations, that's when they
Okay.
are more prone to occur. But also other endocrine disruptive chemicals include phthalates, those plasticizing chemicals. They're in 75% of our personal care products. They're in anything with a fragrance in it, so it's in colognes, it's in shampoos, conditioners, body washes, deodorants, anything with that fragrance, and this interferes with your thyroid. And we have so many of these phthalates that we have, so it needs to say phthalate-free or zero phthalates, and phthalates are spelled PHTHALATES. And so they now have on the bottles of body wash and shampoos, phthalate free.
I'm seeing that more and more.
Yeah.
And PBA free or bisphenol A free. It's
Yeah, but the word's getting out. The
Right.
population's becoming more educated
Right.
on these things.
And
So,
also those forever chemicals. We did a whole teaching on forever chemicals, the PFAS chemicals. And again, we get that from tap water. We get it from, grease-resistant packaging, nonstick cookware. People are still cooking their eggs or cooking their food in these nonstick frying pans that have those PFASs that will affect your thyroid.
You got rid of all those.
You got to get
Yeah.
rid of those.
Stainless steel, right? Just
Stainless steel is the best, or yes. And also grease-resistant food packaging. Stain-resistant carpets contain these PFASs.
that is fascinating. So when you have a bunch of animals and you want to Scotch guard your couch
Oh,
or your
yeah, that's
carpet,
PFAS.
that's all PFAS.
Oh, and you're just lowering your thyroid when you use that or around that. Grease-resistant wrappers. You go to a fast food restaurant, they're notorious for wrapping everything in these grease-resistant wrappers that have PFASs in it,
Mm.
as well as
Well, they're really kind of activated, or they separate from when they're heated. Isn't that right?
there's
Generally?
more release. And disposable coffee cups coated with water-resistant coatings. When you go to your Starbucks or go to your restaurants and use the paper cups, they usually have PFASs in them. So it's found in microwave popcorn bags, it's found in pizza boxes, and grease-resistant food packaging, which is just all over the place.
One that we found this in, and it may make some women sad, is like spandex type pants.
Right.
The stretchy
But you
material.
don't get as much from wearing the clothing that has the raincoats and the spandex as you get it from ingesting it through these other means that we talked about.
So
When you
those are
ingest it, you
words,
get-
though.
Yes. Now, to identify PFAS, you look at the ingredient list, look for fluoro or perfluoro on the ingredient list. That means this has PFASs. So there's still not a good way to find it. You have to search and investigate.
I was going to say, because they generally don't even list, if you're a nutritional supplement or food, you have to list your ingredients, but not if you're a cup,
Yeah, but with this new administration under Kennedy, they're doing that.
They're
making
cracking
some
down on
changes.
that.
Yeah.
Okay.
Now, meds are associated with meds affect your thyroid. Lithium is notorious. Lithium is used for bipolar disorder. They've got some new information that lithium actually helps mild cognitive impairment and Alzheimer's disease, but it's low dose lithium, 5 milligrams. But high dose lithium used to treat bipolar disorder, manic depressive illness, can interfere with your thyroid and can block thyroid, trigger a lot of people on lithium have low thyroid. So again, if you're taking lithium, you most likely need a thyroid med, a natural one we'll talk about later. Now, other drugs that cause low thyroid are amiodarone. Amiodarone is commonly used for atrial and ventricular arrhythmia, and so a lot of cardiac patients are on this, and so they generally have low thyroid. Seizure meds like Dilantin and also gabapentin used for neuropathy can also cause low thyroid, as well as estrogen-containing meds can actually alter the body's production and processing of thyroid hormone. So I have to watch people on estrogen, and I have to many times supplement them with thyroid hormone, a natural thyroid hormone. And then cortisone meds like prednisone can suppress the conversion of T4 to the more active T3.
Mm.
So these people, when they're on long cortisone treatments, prednisone treatments, they tend to get the cold hands, cold feet, and their thyroid gets low. I have to put them on low-dose thyroid usually. And then proton pump inhibitors, like for acid reflux, they tend to don't absorb the thyroid hormones as well, and they can develop low thyroid. So a lot of people with acid reflux on these proton pump inhibitors. And then finally, cancer patients on immune checkpoint inhibitors. See, the checkpoint inhibitors work by blocking the checkpoints that cancer cells use to hide from the immune system. And so these new checkpoint inhibitors block it so the immune system can recognize and treat the cancer. And these commonly associated with low thyroid, which include Opdivo, Yervoy, and Keytruda. And these are great chemotherapy meds, checkpoint inhibitor meds that are associated with low thyroid. So we have a lot of things that can lower your
Find
thyroid.
when a lot of patients, because you hear all the time, my thyroid's sluggish, or I need to get my thyroid checked. I hear people say that generally when they're a little overweight.
Right.
Maybe they've gotten some feedback on the internet,
Right.
and they immediately assume it's thyroid. So do you see a lot of that, and it's not the thyroid
Yes, I do. I see a lot of
that common?
And it's common because a lot of low thyroid symptoms are similar symptoms you see with low testosterone, with adrenal fatigue, with just with depression, or not sleeping well, or stress or anxiety. See, so again, many times it's overlapping, but we commonly see that's why we look at the numbers. And so what we do is we look at the numbers and we look at the free T3. That's the more active T3.
And so
Well,
many
thyroid
times, blood tests in the past, the doctors never did.
They never check. Most doctors never check the free T3 level. They
What
check the
would
TSH.
happen?
They'll check the TSH, and
Yeah.
that's the T4.
The
Is that-
TSH is the pituitary thyroid test. And so if the TSH is elevated, that's a sign your thyroid is low, but it's not always that way. Okay, then they check the T4, and the T4 is the inactive form of thyroid, but they rarely check the free T3. The free T3 is the thyroid hormone that warms up your hands, warms up your feet. I see patients come in and they say, I have to wear socks every night because I get so cold, I can't sleep. And so I know that that's a most likely
You
thyroid.
know, I've lost count of how many patients that have come in to see Don, and they'll say, "Oh, no, my doctor did my blood test.
Yeah,
It says
that's
my
normal."
thyroid's real good." And Don will sit there and go, "Well, not really," because he's looking at the labs in front of him.
Right. Well, I check their thyroid peroxidase antibodies that checks for Hashimoto's. I check their T4. I check their free T3. I check their TSH. But the key number to know is your free T3. And if that free T3 is 2.2 to 2.8, you're sluggish. If it's less than 2.2, it's really low. And I like to optimize that free T3 to a level of 3.0 to 4.1 in men and 3.0 to 4.4 in women.
I
That
feel like women's a little higher.
needs to be a little higher. They need that
Yeah.
extra thyroid usually.
And there are times where you'll see the TSH and the T4 as normal, but the free T3 will be abnormal.
Yes.
So that's not being checked.
Right.
They're not catching it.
Exactly right.
Exactly.
So again, that's the key. And the numbers are real simple. And optimized T3, now the normal free T3 is 2.3 to 4.1. But some labs have 2.2 to 4.1, but an optimized level is 3.0 to 4.1, and that's picograms per ml for men. And for women, the normal for free T3 at the lab is 2.0 to 4.4 picograms per ml. If you're 2.0 as a woman, you're going to have icy cold hands. And I can find those out immediately when I shake their hands. And I check their temperature, it's almost always below 98 degrees. And so again, most men and women with sluggish thyroid feel reptilian. They are just cold-blooded. They're cold, and they're always cold, and they say, "I have to," and they almost always say, "I have to wear socks every night or I can't sleep. I'm freezing. I have to use an electric blanket."
Now,
And if they're not,
do you like the people to do the thermometer test? Where
well, you can. I used to do that. I don't do that as much because a lot of people that do that overprescribe thyroid hormones, and then their heart beats too fast. And you can stress the heart, and we don't want to do that. And people, especially over 60, over 65, they're more prone to arrhythmias, or they're more prone to palpitations. So we want to be careful and not push it too high,
Yeah,
or else you'll get arrhythmias of the heart.
well, that's
But
good.
the symptoms of low thyroid are, number one, cold hands, cold feet. Number two, they're tired. And it's a whole different fatigue than low T. When you have low T or low testosterone and low thyroid, these people are totally
Couch
exhausted.
potatoes.
That's
Yeah.
chronic fatigue.
Right, it's chronic fatigue.
They are couch.
They have low energy. They have weight gain, usually. Oh, now, it's not the belly fat. These people get a weight gain throughout their body. Their face gets chubby. Their eyelids get swollen. And you can tell. I can walk in a room and tell a person's got low thyroid. I remember years ago, this friend of mine sent his mother to me. She'd been to all these doctors. No one can figure her out. And so she came to me. I walked in the room. I felt her hands. And I looked at her eyelids. They were all swollen and just like she was just bloated in her eyelids. I said, "Your thyroid's low." I tested her. She had a severely low thyroid. I put on the natural thyroid medication and just helped her tremendously immediately.
Now, one thing I remember you saying too, that you'll look at people's eyebrows, and if they're
Yes.
beginning to lose their
Yeah,
eyebrows,
and if you are losing this lateral part of your eyebrow on the side, that's a sign your thyroid's low. Their eyebrows start to thin. If you have thick, bushy eyebrows, you usually have a healthy thyroid. But if your eyebrows are thinning, especially the outer edge of the eyebrow, that's a sign that your thyroid's sluggish or low. Other signs include constipation, not only the weight gain, but the weight gain's different. It's the weight gain throughout the whole body, and they get swollen in their face, okay, and in their
What about
jaw.
the eyeball? I've seen you mention when the eyeballs get
Well, that's
real-
hyperthyroid. Yeah, their eyelid will retract, and they'll look like their
their
eyes
eyes are kind of
bulging out.
bulging out.
Yeah,
Yeah.
and that's hyperthyroid. That's different. But these people get constipated. They get dry skin. They get this thyroid hair where the hair is real fine and wispy and it breaks easily. And again, I can look at them and I can tell that's thyroid hair. That's low thyroid hair. And so again, when I put them on
now what's
thyroid,
amazing about that, Don, is I know the ladies are watching this. I've seen girls that they could be really thin, but
Mhm.
they've got that wispy little broken hair.
and that's
And
usually
and
thyroid.
it's usually thyroid,
Yeah.
but so they don't have to be overweight.
No, they don't. That's true.
Wow.
They're more prone to depression and anxiety, but a major sign is swelling around the eyes and face. They get a swollen face. And the fat or the weight gain is throughout the whole body, not just in the belly. So it's a little different.
Now, what is optimize? I keep hearing you say optimize, optimize.
Right.
Will you explain
Well,
what you mean by optimize?
okay, you can get a normal range. A normal range of a thyroid can be 2.0 to 4.4 in a female. When a lady comes in with 2.0, they have a normal level according to the blood test, so the doctor will do nothing. Now, again, most doctors don't run the free T3. That's the key test for subclinical hypothyroidism, where they feel that all these thyroid symptoms, yet these people are cold, they're overweight, they're exhausted, they're constipated, and they got subclinical hypothyroidism, but no doctors run the correct test to figure it out. And so those are the people that really benefit. We want to take that free T3 to at least around 3.0 to 4.4. And then they feel so much better. Now, you don't do it immediately. I don't put them on a huge dose. I'll start them out on pig's thyroid, which is NP thyroid or armor thyroid. That the pig has the closest thyroid to the humans, and it's 4 parts T4 to 1 part T3. And so it also contains all the cofactors that we need. It contains the T1, the T2, the T3, the T4, the calcitonin, the iodine, and all the glandular factors we need to produce thyroid hormone. So now I have a sluggish thyroid. I have subclinical. So I take personally NP thyroid 90 milligrams every morning. And I keep my free T3 about 3.5, and I feel great. And now, again, that's where you know, because your level will come up, your energy will come up, your mental clarity will come up, but you will feel warm and you'll feel energized. That's the key thing you'll find. And so again, the TSH is the other number. That's the pituitary thyroid. That doesn't always relate to improving symptoms. Most of your doctors would check the thyroid stimulating hormone, which is the pituitary hormone. But again, if they're not giving you the free T3, they'll give you Synthroid or levothyroxine. That's the inactive T4. Now, some people can take the inactive T4 and convert it to T3, but many people can't. If you're under a lot of stress, you can't convert the inactive T4 to T3. Or if your sugar's high, you can't effectively convert it over. Or if you have a lot of inflammation, your HSCRP is elevated, you can't effectively make that
Oh,
conversion.
wow.
See? So again, that's why it's important for many to use the active form of thyroid. And again, the TSH is also important, but not nearly so
Now
important.
you have this supplement here called
Yeah.
Thyroid Zone, and I see it has tons of vitamins, minerals,
Right.
zinc, iodine, vitamin B12, schizandra, L-tyrosine.
Right. It has that kelp, ashwagandha,
How does
iodine,
this
zinc.
affect the
Well,
thyroid?
that helps. That's why I love this, because this formulation helps a lot of people convert their T4 to the more active T3. And so you just take like 3 of these in the morning and it helps your body convert it. And so a lot of people don't have to take a medication, and that's what a lot of people would prefer. It's a natural way to boost your conversion of T4, the inactive form of thyroid, to the more active free T3.
Now, if you're on a thyroid med, can you do
Or
that
it
too?
supports, it
Support.
supports your body.
Can you do that with your med?
Yes, yeah,
Take 'em
but
both?
I wouldn't do it at the same time. The thyroid med works best on an empty stomach. When I get up in the morning on an empty stomach, I take it with water,
Right.
just water. I wait at least 30 minutes to an hour before I have any food or coffee or anything.
Because you want it to fully
You want to
absorb.
absorb it. But if I don't wait long enough, like this morning, I didn't wait long enough. I had my coffee, and so now I can feel it. My hands are a little cold.
Now you've got this book, The Healthy Hormone Zone, and it goes over testosterone, which we
And-
talked about in the last show.
Correct.
But then you also have a chapter in here on thyroid.
Right.
So chapter 8, thyroid to reboot your metabolism. Is
Mhm.
there some information in here that can help people that want to get more information on their thyroid?
Absolutely, it helps. And again, I talk about the numbers. The TSH is the other number, the thyroid stimulating hormone, and that number should ideally be 0.4 to 1.5 milli-IUs per liter. And that's, but it's not as important as the free T3. And again, most doctors, if your thyroid is low or sluggish, if it's low or sluggish, they won't pick it up. If you have the symptoms, they won't pick it up. They go by the TSH and the T4 or free T4. And many of them don't even check that. They
And
just check a
people can
TSH.
request this from their doctor. They
Yes,
can
they
go
can.
and say, hey, I'd like to get my thyroid checked, but I also want to get my free
Free T3.
T3, my
Correct.
T4, my TSH,
Right,
my
exactly.
pituitary. Okay, very fascinating. Great information. Are there any foods? I know iodine has historically been a natural ingredient, not
Yeah.
just for,
Oh, good question.
if there's Fukushima or,
Right.
radioactive meltdown, you want to take your iodine, that's key,
Right.
but also for your thyroid.
Well, again, certain foods, again, too much iodine can literally trigger Hashimoto's thyroiditis. So I see some people coming in and they're taking a lot of iodine trying to stimulate their thyroid, and I check their TPO level and it's higher than 36, or it's a few hundred or 1,000. And I said, did you know you have Hashimoto's thyroiditis? And I say, are you taking iodine? Iodine is one of the key minerals. If you take real high amounts of it, it can trigger Hashimoto's thyroiditis or autoimmune thyroid problems.
So really and truly, people shouldn't be treating themselves. They
I've seen
really-
a lot of people that
yeah,
don't treat
they
and they've been
really-
in major trouble.
Yeah, that's
So again,
not a good idea.
the key thing, if you want to just do the thyroid zone, this supports the healthy conversion of T4 to the more active free T3. But if you have major symptoms, cold hands, cold feet, severe fatigue, and your doctor is not checking your thyroid, see another doctor or see someone who does nutritional medicine and does complementary medicine or functional medicine, or you can come see one of my nurse practitioners or see me. It may take you 6 months to a year, but we will check your free T3. We will treat you with the active form of thyroid hormone, which is usually NP thyroid. Now, for myself, I use 90 milligrams. Most women only need 60 milligrams or 30 milligrams. Most men need only 60 to 90. Some elderly people only need maybe 30. Some elderly people only need 15. I have a 90-year-old. I have her on just 15 milligrams of NP thyroid. No, I can't get her to an optimized level because it stresses her heart. So I just put on a little bitty, she's 94, and she is doing great on that little bit of thyroid hormone, 15 milligrams.
So if your doctor will not check your T3 levels, you need to make
Free
sure
T3.
your free T3, you need to make
Right.
sure you set up an appointment with Dr. Colbert. Now, you have a practice here in Dallas. You have a practice in Orlando, Florida. So it's convenient for really, anyone in the United States.
Right.
If you're looking for a nice vacation with your family and you got little ones, it's great to come to Orlando. And Dallas being centrally located, I think it's convenient for everybody.
Oh, it is. We're 5 minutes from the airport. They fly into DFW, and they can take an Uber, and they're there in 5 to 10 minutes.
And we do not take insurance. We do not take Medicare or Medicaid. And people that I know that may put some people off, but it's worth the investment. Your health is worth the
Yeah.
investment to get what you need to know. And that's really how you kind of have to see.
Well, I mean, insurance won't cover these things.
A lot of this,
And
but
so a lot of the doctors that do these blood tests and they stick to the standard of care medicine, insurance can cover that. But you go outside the box and insurance will not cover
Well,
that thing.
again, so many people come in my office. As soon as I shake hands, I know they have a subclinical hypothyroid problem. They bring their blood work from their doctor. He checks a TSH, it's normal. They say, your thyroid's normal. Nothing's wrong with your thyroid, and there is something wrong. They're not converting their T4 to the more active free T3. And when I put them on that small amount of natural thyroid, usually NP thyroid or Armour thyroid, now usually it may not be the first time, may not get the first dose correct, because I usually start low and go slow. And if they're over 60, I'll use a lower dose. But we see an amazing shift once we get the right dose.
How long does it usually take once you're seeing these patients and you've dialed in, okay, their thyroid has issues. Let's go ahead and start dosing them out. How do you?
You will see a change within a few days to a week once we get the right dose.
Okay.
And it's absolutely amazing because they come back and they say, oh, I feel so much better. I'm warming up. I don't need my socks on at night. I don't need to wear gloves. Some people are so cold they wear gloves at night. So again, it's just we're warming them up, and then all of a sudden their energy returns, and then they're able to do things they used to couldn't do.
Well, Dad, this has been a phenomenal show. Get your thyroid checked. Do you know your number? There are over 12 numbers. I think we have 13 numbers because we slid one more number in there.
I think so.
Well, I think we put what happened. I think we did our waist measurement and our weight. That should be one.
Well, regardless, they're important numbers. Make sure you stay connected. We'll see you on the next show. This next number is a free one. If you get it for free, you could boost it for free. We'll see you on the next show.